Thank you. Imagine with me hospitals, healthcare facilities, intensive care units, where patients are up and moving around frequently throughout the day and not laying for hour after hour in their beds. Imagine healthcare facilities where caregivers can go to work and not break their backs, where they can leave their work at the end of their shift feeling the same way as they did when they began their shift that day. The roots have been established in the evidence and the literature. Human beings were made to move. Immobility is harmful to every system in our bodies. And it's not just muscle weakness, which can be profound and disabling for our patients, but it's mental ability, it's our cognitive function. 3 out of every 4 patients in our critical care and our intensive care units, and many in our hospital wards and nursing homes, are suffering from delirium and confused thinking. And in one study of patients that watched them for a year after they were discharged from the hospital, the average age of these patients was 45. 1 year later, less than 50% were able to return to work. What's interesting is it's not just patients. And although critical illness is complex and multifactorial, we know from studies in astronauts, peak athletes confined to bed rest, they suffer a lot of the same problems as we see in our patients in our ICUs and in our hospitals. So we know that immobility itself is an independent factor and an independent predictor of poor patient outcomes. So what I'd like to do is share with you some stories from patients, because these aren't just numbers. There's not just statistical analyses. This is people's lives. This could be you or me, our parents, our grandparents, our teachers, our students, the people that we love. So let's hear from these patients in their own words about their experiences.
I remember I was so weak, I could hardly lift my limbs off the bed. I could not sit up. I couldn't walk. I couldn't stand.
I remember the first time he said, it'll be several months in rehab. And I was like, but this is pneumonia. And it really wasn't the illness that she was recovering from, it was the immobilization that she was now needing to recover from. The reality of how little she was able to do was a real surprise.
Let's listen from a patient who had delirium.
You don't know where you're at, and you don't know how you got there, and you know it's a trip you went on you didn't know you were going on, and now you're awake, and everybody seems to be all excited about it, and you don't know why. Time is gone, and you can't figure it out. The emotional part is you see life as different. You're scared of getting sick. I don't know the rest. I don't know why I feel sad and unhappy. I don't know why. I thought it would get better.
So Mrs. Smithers, her comment, I thought it would get better. Millions of patients like Mrs. Smithers around the world are dealing with these problems for months and sometimes years after they're discharged from our hospital. And I'd like to thank the Outcomes After Critical Illness and Surgery, the OASIS website and ICU Delirium website for permission to use our patient testimonials. I would strongly encourage anybody who has any decision-making authority about whether patients get up or stay in bed to go to those websites and watch the rest of the testimonials and listen to what the patients have to say. But it's exciting because early mobility studies have shown time and time again that getting people up and moving improves delirium, improves function, reduces pneumonia, reduces the likelihood of our patients getting a bed sore, increases the likelihood of them being able to return to their normal day lives. I'd like to share one more patient testimonial with you of what his experience was like being in bed and then also getting out of bed.
Having the nurses have to do everything for you, changing your diaper, washing you, you know, everything. Very uncomfortable. I wanted to get out of bed and do something otherwise. That was wonderful. Getting to see everybody and see how big the unit was. It was nice to get up and walk around.
So sometimes a little scary getting patients up. And getting patients up and out of bed, as important as it is, it can be challenging. There's medical complexity. But in addition to that, the physicality of helping get patients up for nurses and our therapists is challenging. And on an average day, a nurse or therapist, a caregiver, can lift up to 2 tons in just one day. That's a mid-sized vehicle with 4 adult people in it. That much force going through one nurse's spine in one day. So as important as getting people up and out of bed is, the importance of taking care of the caregiver cannot be understated. Safe patient handling programs have been shown to reduce caregiver injuries by over 70%. But in spite of this knowledge, caregivers continue to rank in the top 10 of all industries most likely to suffer a work-related injury. And even in healthcare facilities where they have equipment, often it is underutilized. So I'd like to share with you today a vision of how we change this. How do we create a vision of hospitals and healthcare facilities where patients are moving and caregivers are safe? It starts with belief. And when I say belief, it's got to be more than just reading articles and letting numbers and graphs and statistics wash over us. We have to feel it here. We have to believe it in our gut that this information is meaningful, that Doug and Melissa's story and Mrs. Smithers' story, the people behind these research studies, it's so important to us that our belief demands our action. But belief itself is not always enough. Now, I believe with all my heart, and I left my candy bar out the back because I had a huge, big old, giant-sized candy bar. If I eat a huge, giant-sized chocolate bar, I love chocolate, all in one time, I'm going to regret it when I try my jeans on tomorrow, and it's not going to be good for me. But you know what? A month or so ago, I did exactly that. I sat and I ate a little bit. It was really good, but by the time I turned around, the whole thing was gone. Now, what was the problem? At that moment in time, my desire to eat the candy bar was stronger than my driving force or my motivation not to eat it. When it comes to creating change and transforming clinical practice, we've got to identify not just the belief, but the driving force behind that belief. Now, for me, my driving force is my faith. It's that little voice inside my head that says, Margaret, you've been given skills and talents, and I expect you to use them relentlessly, tirelessly, to make a difference in people's lives. That's not going to be everybody's driving force, but we need to identify what the driving force is and strengthen it and cultivate it. We need to be disciplined in our thoughts. And what do I mean by that? Imagine I'm a caregiver and I'm faced with this patient that you saw in the bed earlier. One way of thinking is, oh my goodness, I've got to get this person up. What time is it? You know, I've still got to pass meds. I have 5 more patients to see. I'm really tired. I haven't even done my documentation yet. Okay, that's one way of thinking. That line of thinking is most likely to stimulate inaction. Or I could think, you know what? I am this person's lifeline today. If they're medically ready to get up, I know that every day I leave that patient in bed, their risk for pneumonia goes up, their risk for a bed sore goes up, their risk of disabling muscle weakness goes up, their risk of not being able to go back and be a productive member of their family and their communities goes up. I'm going to do whatever it takes today to get this patient out of bed. when it comes to safe patient handling. One way of thinking is, oh my goodness, I got to use that equipment. The hospital's got a policy on it, and they told me if I don't use it, I'm going to get in trouble, and I got to go get the batteries, and Or let's hear the thoughts of a nurse who actually did get injured at work.
Talk positively about using equipment as well. Some people might be like, oh yeah, well, I don't need that. And having people be positive about it and be like, hey, I'm really glad we have this, because I can't believe if we didn't have this, we would probably all hurt our backs.
So how we think is likely to dictate our actions, because we're more likely to act according to our thoughts than necessarily our beliefs or our ideals. And when we act in conflict, that creates guilt and shame, and that's not a comfortable feeling for us. But sometimes there's factors that will influence our actions. They can be internal, such as an unwillingness to invest the energy to change, the energy required to challenge the status quo and do something different. Or there can be external factors, productivity requirements, the sheer number of tasks that any caregiver is given to do in an average day. And so we have to start challenging these questions and ask, are we measuring volume or value? Are we measuring quality or quantity when it comes to our healthcare? And we need to start asking some of these provocative questions. Because our behavior is an outward expression of our thoughts, our beliefs, and our values, as expressed through our actions. So if we want to change behavior, we need to go back to each and every action, because our behavior is an accumulation of each action that we take. And we must consistently hold ourselves and others accountable for the new or desired behavior that we want to see. Consistency is hard, but the minute we don't do that, we open the door to that question mark. Well, day shift yesterday didn't get Mrs. Jones up. They didn't use the lift and nobody got in trouble, so why would I do it today? Consistency requires energy. It's difficult. Any parents in the room? Right? Consistency with our kids is tough. And that's why we need to go back to our belief and build that knowledge and that feeling that, yes, it is worth investing this energy at this moment in time. Because consistency is the key to the leap from occasionally seeing behaviors that we like to developing habits in all of the people in our workforce. And then the character of our workforce and our healthcare facilities becomes the collective habits of all of the people working there. So you can see how we build this picture to transform clinical practice. And culture change is really what we're looking for. We take all the principles that we've talked about and we apply hard work, because it's not easy. If it was easy, everybody would be doing it. We have to work hard. We have to inspire with enthusiasm, and we have to persevere. When we do that, that's when we're going to transform clinical practice and create our vision, give wings to our vision of hospitals and healthcare facilities that are more mobile, that are in keeping with the evidence. When our healthcare facilities are places where the caregivers don't have to worry about becoming the patients. Mobility matters. Caregiver safety matters. Every patient, every caregiver, every time. Because people really do matter. Thank you.